All right, well, let's get started then, because I know that we're crunched on time as it is, so we'll get going. We're going to uncover the Miami-J cervical collars, sizing applications, skincare. If you guys have any questions at any time, it's pretty informal. Just raise your hand. Hey, Lindsay, stop. I have a question. So we'll start rolling. There's 4 keys to success with the Miami-J collar. Sizing it up, scooping it up, snagging it up, and skincare. It's kind of cheesy. Basically, we're just saying you want to grab the right size, you want to put it on right, you want to make sure it's tight enough, and then obviously skincare. Your patients are 40% more likely to break down when they're wearing a collar than any other patient in the hospital. So this is something that we're going to constantly battle from the moment they have this put on, probably in the field. Okay. We have a phenotype-driven algorithm. It's a very big word. It just means we're eyeballing sizes. We have no measuring tools. We're just going to look at the patient's neck, look at their shoulders, and we're going to choose a size based on what we see. And I want to pull out one thing for you guys really quick. Do you recognize? Yes, you should have all of you should have this somewhere in your unit or a trauma bay. This is going to have all of your adult sizes on it here, all your ped sizes on the side, application skincare tips. It's two-sided. A lot of people don't know that it is two-sided. So if you guys need some extra ones, let me know before you leave today. Okay, so we're going to go through our adult sizes. Our first one here is a super short kyphotic. They all have these numbers like 200S. I wouldn't worry about that. The name of the size is going to tell you more about it than the numbers are. Okay, so this one is that kind of patient that's that chin to chest, hunched over look, typically geriatric patients, osteoporotic type patients. The next adult size is a stout. This is a big football guy. So I think of like linemen, the guys that are protecting the quarterback. They're kind of beefy on the shoulders up here, big arms, big shoulders. They don't have a very big height to their neck. They have an extra wide circumference, but they don't have a tall neck. Bariatric type patients, your patients after they've swollen up from a trauma, maybe day 2, day 3, might swell up to this size as well. Okay. This is the extra small. This is a pretty rare collar. It's a short neck and a thin neck. We typically see this in patients that are less than 100 pounds. Okay, so if they're 105, they're actually probably too big for this. If you've ever wanted to grab a pediatric size for your adult patient, this is probably the size that you really should grab instead. And we'll cover that when we get to peds here in a second, is why we would grab this versus a pediatric size. This is the tall. This is for a long, tall swan neck. I think of Phoebe from Friends when I think of this collar. We usually see this in adolescents, females. Okay, so they're going to grow up before they grow out. Look like you have a tall neck yourself. So you can use her as a reference. It's always good to know somebody. I'm actually not. People always think that I am. I'm not. I'm actually the neck size. I'm a regular, standard size for adult females. It still is a taller neck. There's just less flesh and muscles on the shoulders and traps than most males, and that's what we usually discern between the two. Otherwise, you're all neck. And it is sort of subjective, so you do have to kind of know maybe what you are or what a coworker is in order to compare. Men usually fit in the short because they've got more musculature. They're going to have a slightly shorter neck. Okay, what would be an exception to the short? Who do you think, female-wise, you could put into a short?
Fat lady?
Actually, I mean, sometimes, but actually sometimes it's not necessarily weight that's going to affect it. Maybe somebody who has swelling. Okay, swelling is going to reduce neck height. So be aware when you are putting someone who's swollen into a collar, they may increase or decrease in swelling, which may change their size up or down. So always note how the collar is fitting that day so that you can change it either. Okay. There's all the sizes. Why don't we put adults in ped collars? If they're just little, tiny, their neck is completely different. So they're not just small adults. They're actually scaled completely different than adults. So they have large occipital lobes. They actually have taller necks. So our tallest collar is this collar right here. So remember that tall that we talked about, the blue one? It's shorter than this collar. This is my largest ped collar, okay? Kids grow up, again, before they grow out. So if you're gonna grab a ped collar for a really teeny tiny adult, you're gonna put them in the tallest collar available when you were looking probably for the shortest. That's why we go with that extra small, okay? So peds are P0 through P3. They are age range. I don't actually recommend that you use the age ranges for sizing, okay? The colors are what I want you to size with. The color.
Correlating with the bras
There you go. Took the words right out of my mouth. Braslow Luton color coding system. You guys use Braslow here?
Yes.
Okay, so as long as you know their Braslow color, you can do that. We all know how to measure. Head to the red arrow, wherever their feet fall is the color, medicine dosing size, or medicine dosing and then collar size. Okay, same system. Up to age 12. So once they're 13, they have to be an adults. Okay, if you forget that, it's on the poster. If you have a child in a collar that you're not transferring, okay, we do need to pad from their shoulders to their hips. Reason for that, because kids, remember we talked that large occipital lobe, that's one of the differences between an adult as well as a ped. They're going to have that large occipital lobe, which if they lay flat, sometimes it pushes them into flexion, taking them out of spinal alignment, pushing their chin into the collar, okay? So if you pad them up and raise them up to the level of their occiput, okay, they're going to lay in spinal alignment, they're going to have a nice open airway, put a collar on, they won't have that digging in either, okay? So all you need to do is folded up towels, folded up sheets, pillowcases. It's not a lot, okay? And I'm actually going to pull out some cards for you guys, and I'm going to pass them around so that we have all the sizes in our minds. And there's two cards. There's an adult card and a ped card, okay? My ped cards are in one, adults are in the other. They have all the sizes on them, so if you ever find yourself having to size and run back to the poster, this may will save you some time. You don't have to take them, that's fine. I did want to point out that on the pediatric card, it has the Braslow colors on one side. On the other, it says Miami Junior padding height. So if you never know how much padding to put underneath their shoulders, look at their size. It'll tell you how much padding to use. And then the side of the badge actually has a measuring tool that you can measure how tall your pad is.
Thank you.
So I'll pass that around as well.
What is it? Pad the head and the
Shoulders to hips. Yep. Shoulders to hips. Okay. This is just some imaging done on an 11-year-old. They have no collar, no pad. You can see their chin is on their chest. Their airway is somewhat restricted. They're not really in spinal alignment, and then they're much more open with the pad. It just shows you and proves to you why we do the padding and why we really want you to remember this part. Here's them being measured for Braslow. Here's them padded from their shoulders to their hips. This is a special pad. You don't need a special pad to do this. Like I said, just towels, folded up sheets, whatever works. Okay? Okay, so we did sizing. Now we're going to go into application. So it's always a two-person job. One person will always hold for C-spine precautions. Other person will do all the application. Make sure there are no pillows behind their head. They should have no pillows while in the collar. They should have no pillows during application. They always need to be flat in the bed. Having pillows has a tendency to push them into flexion. So it takes them again out of spinal alignment. It'll push their chin in, just like the kids. We don't want to increase that. So usually something very flat back there, below their neck would be okay as well. Always ask a doc if you ever think they might be okay or have any questions with that. They'll be able to let you know on their orders. Okay? So you're going to take the pillows, arms to the side, shoulders down. We all know, I'm sure, spinal alignment. While they're holding, you're going to take the back of the collar, which looks like this. It has arrows on each side, which help indicate which way is up. It has the size written down here. It does say back on it, in case you forget. You're just going to depress the mattress and slide it underneath their neck. Okay? I just push it down right next to where their neck's at. You can log roll as well. For the front, it's going to be the opposite of what you think you're going to do. Okay? It does all label on one side here, up in front. It does have the size over here. Instead of taking the collar and closing it and bringing it straight on, like everybody thinks is probably the easiest way to do it, I actually want you to open the collar up and bring it from the bottom up. I want them to land on top of that chin tray. Okay? If you bring it straight on, they never really end up there. They kind of get stuck behind it. You end up trying to tuck it in, and then it hits in the wrong spot. So remember, size it up, scoop it up. This is a scoop. Make sure that you scoop it from the bottom up. Get that chin on that chin tray. Okay? Next part. Okay. If you Velcro it just like this, they'll look okay. You'll go back in the room, and you'll see them hop back in, right? Doesn't really work this way. So we need to tighten the sides up. We have a lot of space in each of them. Open it up. Okay? And I call it curl wrap touch. I curl the collar. I wrap it around the back of the neck, and I touch it up by the ear. Okay? If you don't touch it up by the ear, this piece right here, okay, has a tendency to fall down and dig into the trapezius. So bend it, touch it, and push it up towards the ear. Chin can't sink in, gaps are gone. I still have 2 fingers spaced on each side of the trach hole just to make sure they can breathe. Yeah. You're going to have a little bit of blue touching the ears. That's the way it's going to have to be to protect. We're basically protecting between C3 and C5, and just depending on their ear height, depending on how tall their ears are, how big their ears are, you are probably going to have blue touching the ears at some point. When you have white touching them, then we have a problem, because the white is going to put extra pressure on them, so it's probably too tall of a collar. Get something shorter. Okay? Yeah, it's not fun. No earrings, no jewelry in these either. Okay? Questions on the fit? That's usually the biggest thing, is it's just not snug enough. What do you do when someone says it's too tight? In case you should do. Sedate them.
Check it.
Okay.
And pretend you're loosening it up.
Okay. 90% of the 95% of the time when they say that it's too tight, it's probably actually too loose. Okay. The reason for that is if it's not snug enough, don't tell them that. I'm loosening it. Okay. It's probably because if it's not tight enough, which means it's not taking all of the weight and pressure of the head off of their neck. Their neck is working, so it's uncomfortable. It's going to be restricting anyway, whether it's tight or not. If it's not tight enough, it's not doing its job, therefore it's uncomfortable for them. They're having to hold up their own neck. So I usually, on the side, can fit in about to my first knuckle, and then it stops. You can get into your middle knuckle or almost to your hand. It is too loose. That's how I do it. It's kind of rule of thumb, both sides. Okay? Okay, we saw this. Snug it up, curl, wrap, and touch. If they can fit their chin in, it's not snug enough, okay? Even if they're sitting back here, you have all that blue in front of their chin, it's not tight enough, okay? We don't want to try and pull the back more. We want to push the front in. Okay, most people try and just, because the front tucks into the back, most people just tug on the back to get it tighter. That's not going to tighten it. You have to tighten the front. You need to bring the front back. Okay?
I noticed with the ocean back, it's really hard to get a nice snug fit. Just
Right, now what kind of patients are you putting in the ocean back?
head injuries, so they're swollen and they have.
Are they up and walking? Are they comatose? Okay, okay. All of the, it's obviously designed for patients that are not up and walking, and anytime that you have somebody that's laying in a bed like that, it's going to be more difficult. It is a hard collar to fit. It's not stiff, as you guys know, which makes it actually pretty tough because it can kind of go wherever, versus this one, it kind of settles into the occiput. It has that shape. Ocean back, you can pull it too much one way. It's soft. You can kind of manipulate it, like we talked about earlier. It's tough. So none of these products are easy to work with. I understand. I actually work with them myself back in the day. Okay, we have a sternal pad. This may affect some of how the way your patients fit. Do you guys ever remove the sternal pad for your ocean back patients? Okay, that might also help with the fit. It's going to reduce how much height is on the front. It's also going to take any pressure off. If you're still experiencing a little bit, actually bend that front piece up so there's no pressure on the front. Okay, just make sure you don't toss it out. Okay. On the back, there's 2 buttons. They do come locked and packaged in that up position. Normally, we're never going to want to adjust these, okay? When you adjust them and pull them down, the back loses its shape. So all of that we just talked about, how they fall into that little kind of occiput, it's not like the ocean back, it's flat. So you're not going to really have a good spot for them to fit into, okay? All it does is make it 3D. Okay? I think I've seen one patient ever that ever needed that flattened because he had stitches from his shoulder up to the top of his head, and he was completely flat swelling-wise. Normally we're going to have a curve, and we're going to need that curve in the collar to hold correctly. Okay? The front ones, you're more than welcome to adjust. Some of them adjust better than others. The shorter collars don't adjust as dramatically as the taller collars, okay, because there's more space in here. How these are, is these are down. So the front ones are up, the back ones are up and the front ones are down. To adjust them, you do a half a turn with the arrows so that the arrow points towards the slot. check how we're doing on time. We're going to pull it up, and then we're going to, again, lock it at the top. You can also lock it in the middle. Just make sure you're the same on each side. What that does is it does two things. It drops this chin tray down. So if you have someone with a large chin, someone with stitches, someone with Jay Leno chin, you need more space, drop it down. It also moves the sides out. Again, if you need more space in this area, move it out so that you don't have to change the size, but you give them more space right in here. Okay? Or if it's just not fitting right, if they just look funny, you know it's the right size, you've adjusted it 4 or 5 times, try moving those, and it'll kind of adjust the way that it sits on their face. It changes the pressure. So where the pressure can be underneath, you've now moved it to the outside. Okay? Do you guys discharge?
Not really.
Not really?
Blue moon.
What's that?
Every blue moon.
Every blue moon. Okay, well, there's always going to be somebody that might go home and have to put it on themselves. You guys ever instruct somebody how to apply it themselves? Okay, so I'm going to teach you how to instruct them. Inside each collar bag is a Miami J patient pack. It has written instructions, and it has this little strap. So what you're going to do is where you guys put the back on first and then the front, you are going to have them do the opposite. So when they go home, they're going to put the front on first. So in the front, you just got to kind of move your blue pads. You're going to look for a little button. It's only on one side. When you find that button, you're going to take your Miami J strap, and you're going to hook it onto that button. This allows them to stand in front of a mirror and put the front on like so, so their hands free to then put on the back and then adjust from there. Okay? That's what that is. So that's the only time we want to use that is when we send them home. Okay? If they go to another unit, do your best to get this piece to go with them, because at some point they may have to take that home, and if they lose it, then they don't have anything to put it on with at home. Okay? So, things we want to check for when we walk into a patient's room to make sure Miami J is fitting. We're going to look at their chin. Okay? Make sure their chin is not sitting in front of the collar, sitting behind the collar, but just a little bit of blue in front. Okay? Where they're right on top of that chin tray. We're going to look at the blue on blue Velcro. Okay? That just means that the back is aligned with the front. Okay? We don't have straps that cross. It should be even. You're going to have access in front. Okay? If you find a good fit, you can draw a line on there or just cut off the excess so that the next person knows to draw that all the way to the front. That's a good way to kind of replicate your fit day to day. Okay, but you want to check that, make sure it's even. You want to check their trapezius. That just means that you're going to come over here to your sides where they cross, and if you peek under this little blue pad, they shouldn't have any white digging into their shoulder. Okay? Sometimes you can see it without having to pick up that blue pad, but if you do want to check, I just pick it up, make sure there's no white underneath digging in. It's a little secret. Okay? You want to check your Sorbatex pads. You want to check that they're all lining where they're supposed to. Okay? So it should always be blue sticking out, should never be white patient edges. Something that's touching the patient's skin should have a blue pad. You want to check that they're clean and dry. Moisture, heat, dirt, pressure all contribute to breakdown. So if they're wet, dirty, they've just been in for a few days and haven't been changed, they stink, they need to be changed, they need to be cleaned off. Okay? And then you always want to check the trach opening. 2 fingers on each side will tell you that there's enough space to breathe. So skincare, how we're going to do this. It's really, really easy to do skincare. I'm sure you guys do this all the time. You guys do it once a shift, once a day. Yep. Once a shift, 12-hour shifts. Yeah. You guys ICU?
Yeah.
Okay. So, someone's holding for C-spine precautions. You're just going to unvelcro one side, hinge it open, clean them up, check those pads if they need changing, pull them out one at a time. You're going to have your clean set ready to go. Find your matching shape. Okay, there's a shiny side and a dull side. Just make sure your dull side's down. Put it back in, same with the bottom. Log roll. Make sure that you're doing a log roll for the back. The only way to check their occipital area is by getting them on their and moving their hair when it's open. Okay? So make sure that you move your hair back there, check if there's any redness, anything developing back there. Change those pads out. Okay. Take them to the sink, wash them in hand soap, rinse them out, bring them out, lay them to dry. You guys find yourself needing more than 2 sets.
Sometimes.
We do.
Especially if they have trachs, they're a mess.
Yep.
Burns we go through them.
I was
Because
gonna
they're
say
just
burns
so wet
and
all the
trachs
time.
I hear a lot. Sometimes bariatric patients a little bit more as well.
Sweaty, fever.
Yes. Okay. So we always say a minimum of 2 sets. Those patients probably 3 if not 4.
Yeah.
Okay. You're able to get the pads okay when you need them? No problems? Okay.
Enjoying themselves on the back.
Yeah.
We're not having fun here. We're hard workers. Okay, skin assessment. So skin assess every shift and as needed. You guys are obviously pretty good at finding out when you need those pads changed. All of those lead to breakdown. This might be important for you guys. Changing the initial collar to an extended wear within 2 hours of arrival. May not always be possible. That just means that they're wearing a field collar, one of those hard collars. The longer they're in those collars, the greater chance they're going to get a breakdown. They can get a breakdown in under 2 hours. They can get a breakdown in under an hour. And those ones are not meant to be in long. So they've already been in it in the field. They've already been in it in the ambulance. They've already been in it in the ER. If they come to you, you know they've been in it for 2 hours or more. So one of your first things as soon as they're stabilized should be to get them out of that and into something that's extended wear.
Yeah, but then they clear their spine and we throw it in the trash.
Right.
It's a huge waste of money.
It is.
We put
but
them in a Philly collar on when they
That's-
get
if
to the
there's
trauma
no
bay.
spine,
The
we just
intermediate.
keep them in the Philly though.
if there's some intermediate collar that you use, a Philly is better than a hard collar. So, just as a lesson, I know this really isn't related to you guys. How much do you think a collar costs? You guys have seen it, right, on the bills?
No.
Like $400, right?
Oh, really? Which one? This? The company?
Yes.
Okay.
Okay, that's, hold on, hold that thought. $400 is what your patients are billed, okay? The collars are $35 or less, depending on how many you buy. You guys are at trauma level 1, you probably buy a ton. So I don't want you to be afraid to put a collar on that works, whether it be a Philly, which is like probably an $8 collar versus like a $35 one. Get them into that because that's $8 for the hospital. I know a lot of people think it's $400 because then they see that hospital bill. That's what they bill out to the patients. It is crazy. But I also don't want you to get your patient an ulcer by, well, I really don't want to because they might get cleared. Get them into that Philly. Get them into something out of that hard collar. That's the biggest thing. Extended wear. And that, you know, Philly is, they say about up to 48 hours. So they can be in that Philly up to 48 hours before they become at risk for breakdown. So if you can get them in that Philly, get them into something, get them out of that hard collar. That's huge. That's so big. Okay, you guys know keep skin clean and dry and keep those pads clean, dry, and free of debris. Okay, ocean back, you guys are super familiar with this. I just want to cover a little bit of what patients go into this so you guys can identify them. Could potentially just somebody over 65, somebody with decreased skin, decreased vascular. Not everybody over 65 needs to go in. My parents are 65. They probably don't need to be in an ocean back. But if they're going to be a chronic patient that's going to be in the collar a long time, this could be an indication for one. Respiratory, neurological, or hemodynamic instabilities. Anyone who has a lot of fluid, a long-term ventilator patient, comatose patient, and anyone who has poor skin assessment anywhere on their body. Because if they're going to have it on their body somewhere else, like we said, that 40% chance more likely to break down with the collar on. Imagine what their skin's going to be like under that collar. Edema, blistering patients. You guys know how to clean it. Just wipe it down. If you have the body wipes, it's really convenient. Just make sure that you are drying it after you use those body wipes. You don't want to leave it damp. You're going to need to dry it between cleanings. They're going to get sweaty. It's made from Gore-Tex, which is going to create a lot of heat. Do not put a washcloth or anything in between as a barrier. That's going to absorb that water and hold it against them when they sweat. Okay? And they don't get up. What do you do for your patients who are in restraints that are potential for breakdown? Do you put them in an ocean back? No. Anyone who's at risk of moving that neck does not go in one. I've just asked that because I've seen a lot of patients that are in restraints be put in ocean back. And that's not supposed to support them for anything other than laying flat. So if they're at a risk to move, they need to be in a standard back. Okay, that neck is what we're protecting, not from breakdown at that point.
Even if they have an occipital fracture, we have to.
What do you mean?
If they have a skull fracture, that's why they go in the ocean back most of the time.
Is it?
Yeah.
We don't recommend that as a manufacturer. An ocean back is only while you're lying flat. We cannot guarantee it's going to protect the cervical spine when they're sitting up or doing any sort of movement. That's why we don't, if we have someone on restraints, if you have someone that's on a bed alarm, that's at risk to get up, and they don't know that they're going to do damage themselves, if they don't know what's going on, we recommend that you don't use an ocean back. Your doctors may choose differently, but that's what we say as a manufacturer. This is all just coming from the people who make it. So you guys may have different rules, but that is a soft back. This is a much stiffer back. It's going to be able to hold all of the bony material, whereas the ocean back, because it's soft and it has such a large pad, we cannot guarantee it's going to stabilize. So that's as coming from a manufacturer. So if you have something different, follow your rules, not mine. Okay, do you guys ever see these? JTO, it's a cervical thoracic extension. You might see this from time to time, probably more on an ortho floor. This is for a lower cervical disturbance, so something C5 to C7. Okay, T1, T2. It just slips right onto the collar. If you guys aren't seeing it, I'm not going to bother covering it.
No, we don't know. We do scope.
Perfect. So size it up, scoop it up, snug it up skincare. Got through all of that. I did want to try and save at least 5 or 10 minutes to fit each other, which we have exactly 8. So come up, grab. I might not have your size. Yes, go for it. Questions?
So I find it a challenge, especially when my patient is turned, that I don't have the white plastic digging in, there's just 2 pieces.
Yes.
So that always seems to be a problem.
It's always a problem everywhere I go.
Maybe you have an idea.
Curl, wrap, and touch. If you leave this collar, if you take your collar and you do your wrapping and your touching, I've seen most nurses do, close it up. Remember I told you to peek underneath that pad? You're going to be able to see probably after a certain amount of time that white piece digging in. Okay, this white piece digging in. If you take it and bend it, physically loosen up the collar, okay? Make it so it's not as stiff. It's very stiff when it comes out of the bag.
Like this, it goes like this.
Yes.
Gotcha.
I want you to wrap it around to the back, and I want you to take your finger, this is just the way I find it easier, take your finger and push that up towards the ear. Okay, if it's up there, you can pull all you want all day. It's not coming down. It's not anywhere near my trap, even if I lay down. If you don't do that up towards the ear, I guarantee you it will dig into the trap. I've never seen it dig into the trap after you put it up there, even after hours of it working. So just curl, wrap, touch. Curl around, curl, wrap around, touch by the ear. It's going to feel wrong because you're almost manipulating the collar kind of where it doesn't want to go, but you're doing that's
So you're curling the white
supposed
part
to.
or just
The whole thing. You got it. That just loosens it. It's very stiff when it comes out. This one's, I've done a ton of in-services on this one, so it's really flexible. But if you don't do that, it has a tendency to stay stiff and go where it wants to. Okay? So if you loosen it, it's flexible, it molds and holds up.
Okay.
Okay?
Thanks.
Anything else before we try them on? Okay. So grab a partner and come up, grab a collar. I'll have you guys try them on.
You better get